Think there's no cure for cellulite? Well, now there is, and thanks to new technology, it's easier to get rid of that dimply skin than you ever thought possible. Dr. Jeffrey LaGrasso is here to tell us about Vaser High Definition Body Sculpting. Dr. LaGrasso, good to have you here.
Thank you, Cindy.
So let's talk about this Vaser High Definition Body Sculpting. You say you can get rid of this cellulite and it's permanent?
It is. It is.
How does it work?
You know, it uses the combination of an ultrasound, and I have the handpiece here. If you kind of think of cellulite, there are several things that we can address as a surgeon that causes cellulite. I mean, cellulite's caused by multiple different things, some of it being hormonal, estrogen. It affects pretty much 85% of all women after puberty. But the three things that we can address as a surgeon are there are bands that are pulling the skin down, which are causing the dimpling appearance. There are irregular fat cells, which kind of help to get that mottled look. And in some people, depending on their age, there's a little bit of some looseness of the skin. So with the VaserSmooth, it uses an ultrasound energy, and I can address all of those, anatomical issues surgically. What I'm doing is that I'm using the ultrasound, which comes around this probe right here, and that helps to break up the fat cells. It breaks up those irregular fat cells and makes them nice and even and smooth. With this fragmented edge, this is like an ultrasonic heat knife. What I'm doing is I'm cutting the band and I'm allowing the dimpling to release to be nice and smooth.
So how quickly can people see results after a procedure like this?
I tell patients you're going to see results right away, but the final result is somewhere between 6 and 9 months after the procedure. What happens is, since we're addressing multiple factors which cause cellulite, I can release the dimpling and I can address the irregular fat cells, but some of the tightening of the skin happens last, just the way that the collagen remodels in the body. So that it takes a little bit of time for that to happen so that the skin tightens up to get the smoothest result.
And I suppose most of this is happening on thighs and buttocks?
Typically, the most common areas are the thighs of women, the posterior and laterals are probably the most common, and then the gluteal area.
Well, there's a before and after right there, and that is quite dramatic. It looks like this person got a butt lift on the right, but they didn't, did they? Well,
she had a little bit of fat injected into the buttocks just to kind of, even out the shape and to lift it up. But the main thing was addressing the cellulite, and what I tell my patients is that I can obtain anywhere between a 60 and 80% improvement, which holds at a year.
That's amazing. That was really good. No more dimpling on the other shot there.
It makes a big improvement.
Let's take a look at another before and after here and tell us about this.
This is the same thing. This is a younger patient, who just had some areas that were just bothering her. She pretty much had it since she was a teenager, and I released it, and these are photos just at 3 months out. I'm even expecting them to continue to improve as the skin texture improves over time. But there hasn't been one person that I haven't operated on that hasn't been happy with it yet.
Very good. And could somebody use this on their stomach as well?
You can use it on the stomach. Most people don't have cellulite on the stomach.
Right.
It's not that common, mostly in the leg area. But you can use the Vaser ultrasound to do some liposuction to address different areas of the stomach.
All right. Well, Dr. LaGrasso, that was some very encouraging news there. Permanent cellulite removal. That is good news for so many people. Dr. LaGrasso, thank you very much.
Thank you.